All right, quick question. If your car's dashboard flashed a warning light, would you keep driving for months going, it's probably fine? No, you'd at least wonder what's going on. You might check the oil, listen for weird sounds, maybe even take it in. But when it comes to erections, one of the most sensitive dashboard indicators your body has, lots of guys do the opposite. They ignore it. They minimize it. They blame age, stress, their partner, their confidence, their willpower, anything except what the signal might actually mean. So today we're talking about the first and arguably most important rule of penis health. Don't ignore your penis, because erection changes can be a health barometer. And I'm not saying this to scare you. I'm saying it because if you understand this early, it can literally save you years of frustration. And in some cases, help catch bigger health issues before they become real problems. By the end of this video, you'll know what erections can reveal about your heart, hormones, nerves, and mental health, what changes matter and what changes don't, how to triage the situation without spiraling, and the smartest next steps, whether you're 25, 45, or 65. Let's get into it. Here's the takeaway. Erectile dysfunction is not a moral failure. It's feedback. Sometimes the feedback is lifestyle. Sometimes it's medication. Often it's both. But you don't solve it with panic. You solve it with clarity, tracking, and safe action. Medical disclaimer. This content is educational and not a substitute for medical diagnosis or treatment. Never stop, start, or change any medication without medical guidance. Results vary, and there's no guarantee of a specific outcome. Now, 3 things to do today. First, list your medications and supplements. Second, start the 14-day foundation reset. Third, talk to your doctor honestly about sexual side effects. And one question for the comments. Did your symptoms begin after a medication change or after your sleep and stress changed? Here's the simplest way to understand an erection. It's not just a sexual event. It's a full-body performance test. To get a reliable erection, your body has to coordinate multiple systems at once. Blood flow, circulation. You need arteries that can deliver blood efficiently and veins that can hold it there. If blood flow isn't great, erections are often one of the first places it shows up, because those blood vessels are small and sensitive to change. Nervous system, signal transmission. Your brain and nerves need to send the right signals, and your body needs to interpret them correctly. Nerve issues, whether from diabetes, injuries, surgeries, or other causes, can interfere. Hormones, especially testosterone, but not only. Testosterone influences desire and can play a supporting role in erection quality for some men. Thyroid issues can also matter. Hormones aren't the only factor, but they're part of the orchestra. Psychology, stress, anxiety, mood, confidence. Your brain is the largest sex organ. If you're in fight or flight mode, stressed, anxious, or depressed, your body may not prioritize erection quality. It's not a moral failing, it's biology. Lifestyle and substances. Smoking, heavy alcohol, poor sleep, lack of exercise, certain medications, and recreational drugs can all affect sexual function. Sometimes the penis notices first. So when erections shift, especially suddenly or consistently, it can be your body saying, hey, something's off in one of these systems. That's why ignoring it can be a missed opportunity. Let's knock out a few myths that cause unnecessary shame. Myth number 1. If I can't get it up sometimes, something is permanently broken. Nope. Fluctuations happen. You're human, not a robot. Bad sleep, stress, a heavy meal, alcohol, anxiety, or relationship tension can all cause a temporary dip. Myth number 2. ED is only an old guy problem. Also, nope. Younger men can experience erection issues too, often from stress, porn conditioning, substance use, sleep deprivation, or underlying health issues. Myth number 3. If I just try harder, it'll work. Trying harder is often the exact thing that makes it worse, because pressure triggers stress, and stress pulls you out of the relaxed state your body needs. Myth number 4. If I bring this up to a doctor, they'll judge me. A good clinician won't. And if they do, that's not your problem. That's a sign to find someone better. The goal here isn't to turn erections into a crisis. It's to treat them as information. Let's get practical. Not every change is a big deal, but some patterns are worth paying attention to. Here are green, yellow, and red flags. Green flags, usually normal fluctuations. You occasionally have a bad night after stress, poor sleep, or alcohol. You're fine in some situations, but not others, like you're anxious with a new partner. You notice performance is better when you're rested and relaxed. That's not automatically ED, that's life. Yellow flags, worth investigating. A consistent decline over weeks or months. You're getting fewer spontaneous erections. Your morning erections are much less frequent than they used to be. You can get partially erect, but maintaining it is harder than before. Libido is noticeably lower for a sustained period. These are signals that something might be shifting: stress, hormones, circulation, sleep, medication side effects, or other issues. Red flags, don't tough it out. Sudden, dramatic change with no obvious explanation. Pain, bending, injury, or significant curvature developing quickly. Symptoms like chest pain, shortness of breath, fainting, or severe fatigue alongside sexual changes. Blood in urine, sores, or other alarming genital symptoms. Those need medical evaluation promptly. Again, not to scare you, just to help you respond intelligently. Now, let's talk about the heart connection in a sane way. Erections are heavily blood flow dependent. If your vascular system is under strain due to high blood pressure, diabetes, smoking, high cholesterol, inflammation, or lack of fitness, erections can become less reliable. And sometimes sexual symptoms show up before other symptoms do, because the blood vessels involved in erections can be sensitive to subtle changes. So if you're noticing new or worsening erection issues, especially alongside risk factors like smoking, vaping, high blood pressure, diabetes or prediabetes, weight gain around the belly, family history of heart disease, poor sleep or possible sleep apnea, it's a smart move to treat this as a prompt for a broader health check, not just a prescription hunt. This isn't about fear, it's about leverage, because improving cardiovascular health tends to improve erection quality too. Now for the part nobody wants to admit. Sometimes the biggest culprit is your brain monitoring your penis like it's a stock chart. This is what some therapists call the spectator effect. Instead of being present and enjoying sensation, you're internally watching yourself perform. Am I hard enough? Am I staying hard? Is my partner noticing? What if it happens again? That turns sex into a test, and your nervous system responds by shifting towards stress mode. Stress mode is great for running from danger. It is terrible for erections. This is why guys often say, "I'm fine alone, but not with a partner," or "I'm fine at first, but lose it halfway through," or "the more I think about it, the worse it gets." That doesn't mean it's all in your head. It means the mind-body system is interacting, which is normal. And that's good news, because it gives you more ways to fix it. If you're noticing changes, here's a grounded way to think about it. Step 1. Identify the pattern, not just one bad night. Ask, Is this occasional or frequent? Is it situational? Only with partner? Only when stressed? Is desire also lower or mainly erection firmness? Any pain, curvature, injury, or other symptoms? Step 2. Audit the basics. You'll be shocked how often this is it. Sleep. Are you consistently underslept? Alcohol. Are you drinking more than you used to? Nicotine. Smoking, vaping. Stress. Chronic stress, burnout, anxiety. Activity. Are you sedentary? Porn or masturbation? Any patterns that might be conditioning arousal to very specific stimuli? This isn't moral judgment, it's debugging. Step 3. Review medications and substances. Common categories that can affect sexual function include some antidepressants, blood pressure meds, and others. Don't stop meds on your own. Just note it and discuss with a clinician. Step 4. Consider basic labs and health checks. A clinician may consider blood pressure, blood sugar/A1C, cholesterol, testosterone when appropriate, thyroid when appropriate, and broader cardiovascular risk evaluation based on your age and risk factors. Step 5. Address it directly instead of waiting for it to go away. Waiting can allow anxiety to become part of the problem. Even one supportive conversation with a clinician can break the shame loop. There's no one-size solution because erection changes don't come from one single cause. But here are common effective pillars. 1. Improve circulation and metabolic health. Walking more, resistance training, and aerobic fitness can support blood flow and energy. 2. Upgrade sleep. Sleep is not optional. Poor sleep affects testosterone, mood, and stress hormones, and that matters for sexual function. 3. Reduce stress strategically. Not just relax, but real stress management, boundaries, therapy, breath work, exercise, journaling, time outside, whatever actually works for you. 4. Rebuild sexual confidence. Sometimes that means slowing down, removing goal pressure, focusing on sensation, and rebuilding positive experiences. 5. Medical support when appropriate. There are evidence-based options. The point is, you don't need to suffer in silence. Here's the mindset shift I want you to keep. Erections are information, not identity. If something changes, it doesn't mean you're less of a man. It means your body is communicating. And honestly, that's a gift. Because unlike many health issues, this one tends to get your attention early. And it's often reversible or improvable when you treat the underlying factors. So if you take one thing from this video, let it be this: don't ignore your penis. Not because you should be obsessed with performance, but because it can be a powerful early signal about your overall health. If you want, I can make a follow-up video on the biggest lifestyle upgrades that reliably improve erection quality, the most common mistakes guys make when they try to fix ED, and how to talk to your partner about it without awkwardness or shame. And if you're watching this thinking, okay, I relate to this, here's your move today. Do one small action that future you will thank you for. A checkup appointment, a sleep upgrade, a 20-minute walk, a conversation. Because the goal isn't perfection. The goal is to stop ignoring signals and start taking care of the system that makes everything else work. Like, subscribe, and I'll see you in the next one.